day, ladies and gentlemen. I am Adelfa C. Maranga, criminologist by profession, a faculty member of the College of Criminal Justice, University of Bohol. I am also the Community Extension Coordinator of our college. I am going to present to you this morning the research study entitled Level of Effectiveness in the Implementation of COVID-19 Protocols in Antequera, Bohol. Antequera, Bohol is hailed as the basket capital of the province. An inland town lies in the western part of the island, about 18.5 kilometers from Tagbilaran City and the capital of the province and the major growth center of Bohol. COVID-19 is a highly transmittable disease that threatens the human population worldwide and considered as the third pandemic in the 21st century. The COVID-19 pandemic is putting a pressure on health systems all around the world. In the Philippines, the Interagency Task Force, guided by the National Action Plan, acted the control of the spread of the virus by helping families affected by the enhanced community quarantine. The objectives of this study is to determine the level of effectiveness in the implementation of COVID-19 protocols in Poblacion, Antequera, and to discover the perception of the implementation based on how the residents followed protocols and guidelines during the COVID-19 pandemic. The main theory of this study is the institutional theory with the following sub-theories: organizational learning theory, protection motivation theory, rational choice theory, and chaos theory. In terms of legal basis, anchored on RA 1146-9, otherwise known as Bayanihan to Heal as One Act, enacted in March 2020, granting the President additional authority to combat the COVID-19 pandemic in the Philippines. Another legal basis is Republic Act 11332, also known as the Mandatory Reporting of Notifiable Diseases and Health Events of the Public Health Current Act of 2019 and Executive Order Number 10, signed into law in 2016 to review the 1987 Constitution of the Philippines. The input is the profile of the respondents in terms of age, civil status, educational qualification, and rank or position. Level of effectiveness in the implementation of COVID-19 protocols, relationship between the respondents' profile and their perception in the implementation of COVID-19 protocols, and the difference in the perception of the two groups of respondents about the level of effectiveness in the implementation of COVID-19 protocols. The process includes data gathering and treatment of data, and the output is the recommendations based on the findings of this research. The method used in this study is through survey with the aid of the questionnaire. So let us now proceed with the findings as to the profile in terms of age, sex, civil status, educational attainment, and rank. 26 out of 40 respondents were below 25 years old, and only one respondent were aged 46 years old. As to sex, majority were single. As to educational attainment, 100% were college graduate. And as to rank or position, PNP personnel and medical staff were also 50%. In terms of the level of effectiveness in the implementation of COVID-19 protocols as to contact tracing, quarantine facility, and COVID-19 protocols. Conduct community-based contact tracing and disinfection as indicator got the highest mean of 3.73, while contact tracer acts as navigator during contact tracing and monitoring of health status of all close contacts got the lowest mean of 3.45. As to quarantine facility, indicator 5 got the highest mean, while indicator 1, 3, and 6 respectively got the lowest mean of 3.45 and ranked 5.33. As to COVID-19 protocols, indicator 6, washing of hands regularly using disinfectant, got the rank of 1 with a weighted mean of 3.91, while doing 24 hours patrolling to ensure the safety and security of people got the lowest rank of 6 with a weighted mean of 3.45. Conclusion. The COVID-19 protocols as implemented by the PNP and medical frontliner in Poblacion, Antequera were very effective based on the findings of the study. But there are some recommendations that were formulated to enhance some of the areas of concern. So these are the following recommendations. PNP and other government officials must strictly maintain the standard policies in fighting the spread of COVID-19. Another one, provide health education to individuals who have close contact with COVID-19 positive and strict implementation upon entering and leaving the quarantine facility. Another recommendations based on the findings is to allocate funds to improve the quality of the quarantine facility. And the last one, based on the findings of this study, the researcher recommended to perform regular monitoring and to avoid, or in order to avoid, mass gathering. So that ends my presentation. Thank you very much, and once again, good day.